Good morning, everyone. Before we dive into the clinical charts, look at the board. I want you to quickly list the primary social factors you think lead to hospital readmissions in your current units.
At the end of this 7-minute session, you will be able 1. Define SDOH and identify focus areas: food, transportation, and stable housing. 2. Explain the link between SDOH data and improved patient discharge outcomes. 3. Demonstrate non-judgmental questioning techniques during admission. 4. Differentiate between clinical symptoms and social barriers.
Often we see a patient return with a wound infection or uncontrolled blood sugar, and we label it non-compliance. But is it? Today we are going to define social determinants of health, SDOH, the conditions in which people are born, grow, live, and age, and specifically how food, transportation, and stable housing dictate whether our medical treatment actually works once the patient leaves our doors. There is a direct correlation between collecting SDOH data and improved discharge outcomes. If we don't know a patient has no refrigerator, how can we expect them to store their insulin? Here are a few crucial points to consider. Food insecurity. It's impossible to adhere to a diabetic diet if you don't know where your next meal is coming from. Housing. Unstable housing leads to higher risks of post-operative infections because there may not be a clean environment for dressing changes. Transportation. We often see no-show patterns. These aren't always due to lack of motivation. They are often due to a lack of transportation. How do we ask these personal questions without sounding like we are interrogating them? We use normalization statements and bridge phrases. We want to use the Prepare tool, a standard for clinical SDOH screening. Role-play example. Instead of asking, "Do you have a car?" which can feel judgmental, try a bridge statement like, "Many people in our community find it hard to get to the pharmacy. How do you usually get your medications?" As bedside nurses, our job isn't just to document, it's to trigger action. When you identify a barrier in the electronic health record, EHR, your next step is an immediate referral to social work or case management. This ensures the holistic care we talk about actually happens. To wrap up, SDOH isn't just social work, it's nursing work. Remember the impact of food, housing, and transport on clinical outcomes. I want you to construct a plan to integrate one bridge phrase into your daily shift report or handoff today. When we hand off a patient, don't just say vitals are stable. Say, the patient is stable, but we've identified a transportation barrier for their follow-up, and social work has been notified.
Let's ensure that when our patients leave these doors, they have everything they need to stay out. Thank you for your time and your commitment to holistic nursing care. Thank you for watching.